Welcome to the International Federation of Rural Surgeons patient education videos. Today we're going to discuss about the treatment options for BPH in rural areas. Earlier we saw how to diagnose it and how to evaluate it. Today we'll discuss about the treatment option. As the slide shows, there are several options. One is watchful waiting. There's no need for any treatment. Then there is the medical treatment. Then we have the various modes of surgical treatment that are usually available. And now there are a few minimally invasive modern procedures. We'll see how to make use of these options. So the watchful waiting is when we do a symptometrogram or bladder pressure studies and find that the symptoms are mild and the pressures are normal. So then there's no need to actually treat. But then we said that if the voiding pressure or maximum voiding pressure is between 60 to 90 centimeters, then we could consider medical treatment. What are the indicators that will point to the need for surgical treatment? As the slide shows, the older you are, it's better to offer surgical treatment the earlier. If the prostate size is large, then again it is good to treat as quickly as possible. And if the PSA is above 1.6, in other words, the prostate size again is large, then it is better to offer surgical treatment. If the symptoms are quite severe and the patient needs treatment, or in the symptometrogram you find that post-void residue is more than 40 ml, or as the bladder pressure studies show that the pressure is more than 90 centimeters. These are the indications for considering surgical treatment. What about the medical treatment? There are two groups of medicines. One group which decreases the size of the prostate. The prostate, earlier we saw, has two components. One is the prostate glands which start growing. Other is the capsule and muscles and connective tissue inside the prostate. One group of medicine decreases the pressure generated by the connective tissue and the capsule and so on. And the other group decreases the size of the prostate. And then it is possible to use a combination of these two medicines also, which are actually beneficial. Then how do you decide which group to use? This is decided by the doctor based on the clinical findings. Say if the size of the prostate is small and it's predominantly the tension within the prostate because of the contraction of the connective tissue and muscles, which causes the obstructive symptoms, then we use one group called alpha blockers. But if the size is large, then we use the other group which decreases the size of the prostate. And sometimes with time, as the prostate size increases, you can use both the groups and it will cause a beneficial effect. And recently they found that some medicines, including those we use for diabetes, does actually reduce the inflammation in prostate and would be beneficial. So these are for patients who have a maximum voiding pressure between about 60 to 90 centimeters of water. Then there are some conditions where you would rather go for immediate surgery. The most distressing one is, of course, the acute painful retention of urine. The patient is unable to pass urine. So obviously, when you can give one trial of void and generally doesn't benefit, and it's better to consider surgical treatment. And again, if the bladder is very large and palpable, and if the back pressure changes causes damage to the kidney, or there is recurrent or frequent infections, if there is blood, and if there are stones and other reasons for treating it. These are instances where you immediately consider surgical treatment. The standard treatment which is available now is called TURP, or transurethral resection of prostate. Here, there's a special instrument through which the current passes, and the prostate is cut into small bits and then washed away. Here, I mean, this has been there for a long time and is considered the gold standard of treatment. But the problem is that because you cut these prostate into small tissues, blood vessels are cut. And this can cause a significant bleeding. And you need to have special expertise to stop these bleeders. And also, sometimes or quite often, blood is necessary during surgery. And then the blood vessels which are open can absorb the fluid that we use for irrigating. And that can cause changes in the body due to dilution of the blood. And the irrigating fluid sometimes can cause even blindness. So these, even though it's a standard treatment, does have a small amount of problems, which is only about 0.2%. And then the open surgery used to be the treatment available 4 or 5 decades ago. But then even now it has some value. If the prostate gland is very large, or if there is a problem because of spine and hip joint problems, so that the patient cannot be positioned in the correct position that is necessary for surgery. Or if there is a large stone and other problems that need to be tackled at the same time, then sometimes doctors would consider open prostate surgery. And there are several other minimally invasive surgeries. Obviously, these things are minimally invasive, which means there is less bleeding and less problems. On the other hand, these would make the treatment very expensive and generally out of reach of the rural patients. And recently, the laser treatment has been the one which is being promoted very vigorously. But what is best for rural areas is what we offer, what is called the transurethral vaporization of the prostate. Here, very high current is used and a special equipment is used to vaporize the prostate. This is almost similar to the laser treatment, but then it can be done more quickly than laser, and we don't need all the expensive equipment that laser treatment requires. And just like the laser treatment, the drawback is that we might not have enough tissue for biopsy or making sure there is no malignancy. So what we do is resect a little bit of tissue for taking biopsy, and the rest we do vaporization. It's a very safe surgery. There's no significant bleeding or any complications which are related to absorption of water or the irrigation fluid. Thank you.